Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Before today's episode, an important message. The White House has asked Congress to rescind funding that was already approved for the Corporation for Public Broadcasting. That funding supports trusted, independent journalism like the interview you're about to hear. Without it, Idaho Matters could face serious cuts. Learn how you can help protect public media at boisestatepublicradio.org/funding. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. For 65 years, the Ada County Medical Society has been bringing doctors and medical professionals together to build a stronger community. And every year, the group honors those who have contributed significantly to the local medical community. In fact, Idaho Matters was honored to receive a Friend of Medicine award. So today, we continue our coverage of the local medical community by highlighting fellow 2025 Physicians of the Year award recipients. This year, the ACMS gave their inaugural Vitality Champion Award to Dr. Deb Roman with Finding Health. And we're lucky enough to have Dr. Roman joining us to talk more. Welcome to the program.
Thank you for having me.
So, Dr. Roman, I was so moved by the words you spoke at the event back in May. Can you talk a little bit about what drew you into the field of medicine?
Yeah, actually, I was going to be a teacher, and then I was going to be a speech therapist. And I wound up working at a home for children that had been abused. And it was a very powerful experience, Gemma. These were children who were really traumatized, sometimes would just cry for hours in a room. It was so hard. But what really struck me was the physician that was working as the director. He would walk into a room and the children would settle down. They would just kind of come over, sit on his lap. He didn't say much, but his presence was so beautiful and accepting. And I remember seeing him sometimes really late at night because I would stay after hours and he would be sitting in his room with this little quiet light, looking things up. He always was calling people, trying to figure out how to help them. And I went home and said to my parents, okay, I'm going to be a doctor. So they, do you want to rethink this? And I'm like, no, I really don't. So, yeah, I wish, now that I look back, I wish I had had the chance to thank him. I've written about it, but I never had the chance to call him and let him know how much he had affected me. And also to just be so grateful for what he did for those children. It was so beautiful to watch that.
So let's fast forward now, because you are a leading voice in advocacy for physician well-being. And in fact, you talked quite about this during your acceptance speech at the event in May. What was it that made you really recognize that yourself and your medical colleagues really need to take care of themselves, right? And it needs to really be incorporated almost into a part of their workflow in some ways.
100%. It really started happening for me. I love medicine. I've always loved practicing as a physician. And I was surprised because somewhere around 2012, somewhere in that range, a lot of my friends and my colleagues were coming to me telling me how unhappy they were. And I thought, what's happening? And I wound up reaching out to this wonderful person who's a physician and a researcher at Mayo, Dr. Colin West. And I had done a lot of reading, but I wanted to talk to him about what is he learning? Like, what's happening in our society that physicians are experiencing this level of distress? And so
Mm.
he's this wonderful human who's become a good friend. And he said, Deb, just give me a call. And we sat down on a call and he just shared with me a lot of the research. Um, and then we started to think about, we brought him to town for a conference. We wanted to like put light on this. How do we let people know, number one, that let people that don't know that this is happening and
Mm.
honor the experiences of those that are experiencing it, and then figure out how do we move forward together to address this. Um, so that was really the moment that shifted for me, is hearing so many of my colleagues say, this is not working for me.
Mm. The ACMS specifically highlighted the contributions that you've made to the ACMS's Physician Vitality Program. Can you tell us a little bit about the program and what it does?
Sure. So around 2016, I think it was, we started. And when I do say we, I really, I really want to emphasize that there's so many people that have brought all this work forward. Um, and so we started thinking about, how can we take away some of the stigma that's associated with helping ourselves? So at the time, some physicians do not, and still to this day, do not reach out for help because there's concerns about having that on their record, or being judged either by their employers or even by their peers. And so we wanted to normalize that more, and we wanted to give people the
Mm.
chance to get that work done. So we set up a program that had been started somewhere else, similar. Um, where we offer physicians and other members of the Ada County Medical Society, other clinicians, 5 free counseling services per year, um, sessions per year. And we vet the counselors. We've made sure that they have experience with many of the issues that physicians are dealing with. They've worked with physicians and other clinicians. And we also wanted to make it accessible. So we talked to them about, would you be willing to meet after hours so that a
Mm.
physician does not necessarily have to walk into a waiting room with patients and feel uncomfortable, if they would feel uncomfortable, right?
Hmm.
And would you be willing to work with their schedule? So knowing that they might have to meet at different times and things like that. So we pulled together counselors, and it's been very successful. We're really hoping that we're decreasing the stigma around that.
How important is it to take care of a doctor's mental health? And I know that might seem like a simple question, but there are such ripple effects, right? When any of us don't prioritize our mental health.
Right. Um, of course, it's essential. Yes. I would say to you that there's a couple factors here. Um, Physicians go into this field knowing that we're going to be challenged. And
Hmm.
at some point, most of us have to figure out how we're going to take care of ourselves, because this is a marathon. It's pretty much, many of us just, this is for our whole life, right? And
Hmm.
so the things that started happening, though, I just want to back us up for just a second, is that, when medicine changed so dramatically over the last 20 years, most physicians became employed, when they used to have their own practices primarily. There were a lot more administrative and regulatory demands, which would take a time away from physicians and their patients. And then we added COVID, which added a whole nother dimension on many levels. And we've also added the politicalization of medicine. So I just want to honor the fact that there's all these factors that are affecting physicians right now, um, that they didn't necessarily have when I was starting out in practice. which was interesting.
Mm.
So I would say the
Hmm.
research is really clear that physicians are inherently resilient and that we have found ways to address, how we have to take care of ourselves. But at this point, there are so many factors that are affecting our well-being that it's become, to your point, critical that we have ways to address some of these stresses that we're trying to navigate on a daily basis.
Hmm. I think that's so interesting because I think about even in the line of work that I do. People always ask like, how do you handle, seeing all these horrible things in the world or having to know about, all of, the everything that's going on in our world right now,
Sure,
right?
sure.
And I'm highly aware of needing to take time, right? And I make that time. In particular, I was just on vacation with my family, and people asked me like, "Are you looking forward to it?" And I said, "I'm looking forward to 2 weeks of not having to know anything that's going on in the news. I am not right." But it's
Totally.
and some people look at me like, "What? Well, but I mean, that's your job." I'm like, "But I need to take a break from it. Like I really need
Yes.
to honestly shut it off." It's difficult to do, but I've
Yes.
trained myself to do it during those times. So with physicians, I mean, because I do think it's such a calling for you. And sometimes I would think, Dr. Roman, that part of them taking care of themselves is stepping away, like taking a vacation, right? How do you get to that point though when it's such a calling to say, I actually need to take time to recharge?
Right. So I think there's several pieces there. One is that what we've thought about in our community is we have to create spaces where we can have these conversations, right? Where
Mm.
people can talk
Mhm.
about the fact that they're struggling to step away, or I don't know how to step away. What does that even look
Mhm.
like? Um, and so having these conversations with peers to be able to say, this is something we're all feeling. What do we do about that? And how can we support each other in doing that? I remember there was a time where a colleague of mine called me up and she said uh, that she had been diagnosed with an aggressive form of cancer. And she and I were working on a project, and she said, but I want to let you know, no worries, I've got it all settled. I'm going to go through the chemo and the radiation, and then I can handle everything you and I are doing as well as my practice. And when she
Oh.
took a breath, I said to her, maybe this is a time for you to take care of you. And her point, which is a really important point, Gemma, that I want to bring up, is that she said to me, Deb, I stopped doing that years ago when I was told that my patients come first. I don't really know
Oh.
how to do that. And I thought, wow, that was so profound to me. And as we've spoken about those kinds of situations in our community, we've thought, how do we come together more to talk about these things and to encourage each other and to share ways to do that? Um, one other thing I would add is that a vacation won't be enough. When
Mm-hmm.
people are working at this level of intensity all the time, what I say to the students, to the medical students when we're talking is, you know, what are you doing every day that will give you the opportunity to catch your breath and to allow your heart rate to come down, um, and to honor your experience. And I feel like this is a daily practice. When I feel my heart rate starting to go up and I feel like my schedule's pretty intense, or if I'm dealing with a patient who's really struggling and we're human, we feel empathy and we feel their pain. So I realized that, oh, this is really really hard to watch and to um, be present for, but I want to be present for it. I'll say to myself, okay, you need a break. You need 10 minutes to sit down and meditate, do a little yoga,
Mm.
take a walk outside, call a friend, let your heart rate come back down. So I feel like to me, this is really a practice that we need to do regularly, um, really daily.
Oh, I have to tell you, not only was I just moved by your acceptance speech in May at the ACMS when you were given the inaugural award for Vitality Champion Award. I literally, Dr. Roman, could talk to you all day long. I mean, because I think what you are saying resonates. It doesn't even matter what profession you're in, right?
Of course,
It
of course.
and the work. So I'm so curious before I let you go. The work
Yeah,
that you do, I can tell just by our conversation, it truly is a calling for you.
yeah.
How have you seen what you do make a difference for our community as a whole? Because when physicians are healthy, I would think the rest of us are healthy.
100%. Um, I think that one of the beautiful things that's happening, Gemma, is that physicians and other clinicians are recognizing that we can turn to each other. And so there's networks developing, like, we'll check in. Are you okay? Even when we start meetings, which is really funny because we have, like, we have a plan, right? We have an agenda that we think we're going to get through. But we
Hmm.
always start, many of our meetings in many of our groups are started with, how are you really? How are you really? Right? Because there's so much happening. And I think people have become are so grateful. I know I am, for that time where we can sit with each other and say, actually, not so good, not so good.
Mm,
And sometimes it's not that someone can make it better, as you know, in your work. We can't always make this better. But as I was mentioning in my this award ceremony, um, we can, I mentioned that there was a physician who I really love, who I think did beautiful work in the world, a man named Paul Farmer. And
mm-hmm.
he did this, he really spoke for those people that didn't have resources and couldn't get the care they needed, and tried to make sure they got what they needed. And he talked about this idea of accompaniment, this idea of, we can't always make it better. We're not going to always be able to take away the pain, but we can walk with each other. We can accompany each other. And I feel like that's what's starting to happen in our community, is that people are accompanying each other. And they're doing it with a deep sense of authenticity. We're giving each other permission to show up in pain or struggling or with our joy, but we're allowing for those moments together. And I think it's decreasing the distress significantly.
I want to thank you so much for taking time to talk with us today. We've been speaking with Dr. Deb Roman. She is the inaugural award winner of the Vitality Champion Award from the Ada County Medical Society. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you're going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.